Window period for HIV test. Hello friends, today let's talk about various types of HIV testing and also look at their window periods. Note that using any HIV test method before its window period will give you a false negative test. Having said that, if you are a new visitor and you would like to learn from our expert physicians, subscribe today. Alright. There are 3 ways HIV is tested today. 1. Antibody HIV test. 2. Antibodies and Antigen HIV tests. 3. HIV RNA tests. Before we look at each test, let's understand some of the terminologies I will use later. 1. Window period. This is the time after HIV exposure to the time when a certain test will give accurate HIV test results. 2. HIV antibodies. After a few weeks or months following HIV exposure, the body will begin defending itself from HIV by producing antibodies. Antibodies are commanders of body's defense against infections. 3. HIV antigens. After a few days or weeks, HIV will develop certain proteins in its core. The body will identify HIV by looking at these antigens. Alright, let us look at the window period of each test method now. 1. Antibody HIV tests. Examples of these are rapid tests, point-of-care tests, self-testing kits, and others. These are best used after 90 days. Using antibody tests before 90 days will result in possible false negative tests. 2. Antibodies and antigen tests. These tests detect both antibodies and antigens. Examples of these are 4th-generation HIV tests, whose window period is 2 weeks to 45 days. 3. HIV RNA tests. An example is PCR test. These tests look for HIV directly and have the shortest window period of from 10 days to 33 days. I hope you guys now understand window period for HIV tests, and you know which test you need depending on your last HIV exposure. If you need to know these test accuracies, please, we already have many videos explaining test accuracies. Thanks for visiting, and don't forget to subscribe today.